In our Sunday Spotlight this morning, Florida's growing opioid crisis, as we just talked about, a major cause for concern on many levels. More and more people are dying from opioid-related deaths across the state. Now, in 2015 alone, more than 2,500 people here in Florida died with at least one prescription drug in their system. But the true question really remains, how do you get someone the help they need before they head down a deadly path? Dr. Jason Field with the Advanced Recovery System joining us this morning. Thanks for being here, Jason.
Thank you.
Yeah,
Thanks for having me.
You know, the big question is, what is the #1 problem you're seeing when people are trying to, or when you're trying to get people help?
Paul, the #1 problem, in my experience, being an addiction treatment professional, is access to care and then having the ability to pay for the care. Indigency, inability to pay for treatment, goes hand in hand with a lot of individuals that are struggling with substance use disorders, especially opiate use disorders. When they are ready for treatment, a lot of times they don't have insurance, and they have to go to community treatment centers, which may or may not have funds for them.
Mm-hmm.
So definitely improving access to care starts with having funding for care. And also, what I would like to see the attention in the state and nationally going. So
then that means you want more dollars from the state and Washington to come in to help these people who you talked about are indigent.
Absolutely. From a national level down, we really need to increase funding. We need to have the centers open and available to give evidence-based treatment, which includes medication-assisted treatment. And we really need to have the ability for them to, once they go through the detox from these substances, to be able to continue in treatment, because treatment works. Addiction treatment is a disease. Well, addiction is a disease.
And that's the thing.
There's evidence-based treatment for it.
I want to just jump in there. And, you know, for people who do not have any kind of experience with drugs or alcohol, any kind of addiction, and they can't understand it, how do people get hooked on such powerful drugs?
Well, it's a phenomenon that occurred with opiates, prescription opiates. It's a phenomenon that occurred primarily in the 1990s and 2000s. Pain was identified as the fifth vital sign, and a lot of attention was given to treating pain. And unfortunately, there weren't a lot of guidelines for primary care providers and specialists to prescribe opiates safely. So you had many people being prescribed opiates for chronic pain, pain that goes longer than 3 months. And once they're started on these opiates, they continue them for too long and they become dependent.
So we talk about the pill mills, essentially. Is that what we're talking about?
That's right. Pill mills were set up. A lot of them have closed, thankfully. But pill mills were giving large amounts of opiates and other substances dangerous prescribed with opiates to treat chronic pain.
I want to talk about fentanyl, and fentanyl's been in the news a lot lately. The synthetic opioid, it is 50 times more powerful than heroin. Police are coming across more and more cases of it with drugs being laced with it. Explain to us how dangerous this can be.
Fentanyl is extremely dangerous. Fentanyl should only be given in a hospital setting. Under the direct supervision of in surgery or by an anesthesiologist. It is a very potent opioid, a synthetic opiate that is 1,000 times more potent than morphine. Unfortunately, it's found its way into heroin. We've done a good job. A lot of attention has been given to decrease the number of prescription opiates going out, with the prescription drug monitoring program started in the state in 2011, where providers can see what their patients are getting in terms of opiates and other controlled substances by running a profile. It has decreased the number of prescription opioids going out.
Right.
Also, there are new guidelines from the Center for Disease Control, which is helping primary care providers more safely prescribe opiates. But unfortunately, as the number of prescription opiates going down and decrease is occurring,
right?
People have switched to heroin because street heroin is cheap, readily available, and now that's the new epidemic.
I want to interrupt there because I only have about a minute left, and I want to dig deeper into the drugs that have become the leading killers in Florida. And if we have this, if we take a look there, you at home to watch this, this is from FDLE's annual report. In 2015, heroin deaths totaled 779, fentanyl deaths 911. And in 705 of those fentanyl cases, it was fentanyl that was the actual cause of death. So, Dr. Fields, I ask you, how disturbing is that to you in comparison to, say, other drugs like cocaine?
Well, it's the new epidemic, and cocaine isn't causing as many deaths. All substances cause morbidity and mortality. However, opioids is the new epidemic. In 2012, 260 million prescriptions for opiates were given nationally, 260 million. Between 1999 and 2014, there were 165,000 deaths. That's a good-sized city, right? Across the nation, there were 165,000 deaths in that time frame directly related to prescription opioids. So it is the new epidemic. It's causing many deaths, and I would like to see more treatment available. I'd like to see more individuals getting to treatment and having funding for the treatment. And there needs to be education on the evidence-based treatments that do work, including medication-assisted treatment with methadone, Suboxone, buprenorphine, as well as Vivitrol, naloxone.
And we got to cut you off right there. Dr. Jason Fields, Advanced Placement Systems, thanks for being here this morning.
Thanks so much.
Yeah.